It's Marcus Munger, and today I want to talk to you about posture. We've talked a little bit about low back pain and pain down the leg, the sciatica type pain. And one of the things that I think a lot of us will miss is just posture in general. It's a very simple thing that we can do to help reduce our low back pain. And it just takes a little bit of knowledge and just a little bit of understanding of what good posture looks like. For years, we're always looking for that one solution to help manage out our pain, whether it's at work or we're at play or we're sitting watching a movie. This is just some super simple things you can do. And for us that don't like exercise, you can just start with posture, and hopefully that alone will just make a big difference in how you feel. So today I have my assistant Carrie with me, and we're going to first talk about one main thing. If you start having back pain coming on, and you start feeling your low back or pain down the leg, first thing is don't sit longer than 20 minutes. That's like the number one thing. Like get up and move often, all right? Don't be sitting still for very long. The next thing we want to do is to look at proper posture. So Carrie's in more of an upright chair. This is a great chair to get started on better posture as opposed to your couch or a recliner, for instance. Both of those offer no support for your low back, even though it feels good at the time. How do you feel when you actually get out of the couch, how you get out of the recliner? It's pretty sore, it takes a little bit of time to get up, and then you can finally start moving. Well, if you work on good posture to start, it's going to make a big difference on how you feel when you actually get out of the chair. So today, one of the things we're going to use is a lumbar roll. This is a McKenzie lumbar roll. There's many options for rolls, but the main thing with the roll is to make sure we create a nice curve in our lumbar spine. Most cars don't really support our back that well as our standard chairs at home. So if again, you're having back pain, find a good chair that has proper support. So the lumbar roll is going to come in behind the back. You're going to make sure that the hips are to the back of the chair. It's going to go right into the small of the spine, and then you're just going to rest right over the top of it. And the benefit to the lumbar roll is you don't have to think about maintaining that arched back position in order to reduce your pain. The roll does that for you. All right, this is something that you can purchase, but if you're really a cheap low back pain patient, then you can consider a lumbar or a rolled up towel. All right, everyone has a towel. You're going to just roll it on up, and it should have good thickness to it. This is a little bit more firm initially than the lumbar roll, but again, take that, slide it to your back, and you're going to lay right over the top of it. I'm sure many of you have making those 2-3 hour drives where you finally get out at the rest area, feel pretty stiff in the back, takes 10-15 steps to get there before it starts to go away. This is a good example of why you would want to use a lumbar roll. I've used even like a rolled up sweatshirt at times, just put it right behind my back, and even that can be enough to help reduce your pain with sitting. So you're going to consider a lumbar roll, a rolled up towel, a better seat to sit in, and even if it is in the car, sit this chair up more upright, or even maybe tilt it more forward so that your back is going to be more lordotic. Okay? So I'm going to have Carrie just slide forward in the chair. And I just want to show you the difference between proper posture and improper posture. So if Carrie really slouches, you can see that rounding out. And then if she sits up really tall, we can really accentuate her low back. And sometimes that could even be sore on what we call facet joints. So you want to just let that off about 10%, and that'll put you right at the proper position for your back. Okay? Go ahead and stand up, Carrie. One of the other things we want to talk about that you can do simple things at home is maintaining your back in a good position. So if Carrie just bends forward, it's going to round out. Or let's say she's doing dishes and she's kind of bent forward a little bit, it gets rounded out. And now in those two positions we call stooped position or forward bent position, puts a lot of pressure on our disc and our low back, and that can create pain in the back. So what you'd want to do the first 3 hours of the morning especially is to avoid forward bending or stooping where you're slightly bent. What we'll try to do is we'll get our feet in a stride position and maintain that lordosis and bend to the hips All right, like brushing your teeth or doing your dishes, you can always try to maintain this lordotic curve in your back. All right, like Carrie, just sit for a minute. We're gonna grab the lumbar roll. And again, it's gonna slide right up. She's gonna slide her hips in. And she's gonna have proper position. So why does the lumbar roll work so well? If I had a cut on my knuckle, and every time I bent forward, all right, I would start to bleed, all right? So that's like a sciatic nerve. It's back here in my disc. Every time I bend forward, puts pressure on it, and I get this pain down in the leg or in the buttock. And if I get myself more upright, it'll help reduce these symptoms. Just like keeping this finger together for a period of time will help reduce the blood coming out. And then that way, as it heals, I'll be able to start to bend again. All right, so all day long we have postures going on. One, in sitting, two, we're bending, things we're working over. If we can knock out a good posture 80% of the time, you can really reduce chronic back pain. So today I just wanted to discuss proper posture with you, give you a few things to look at with the lumbar roll, with a towel roll, with a rolled up hoodie in your car. Like any one of those things are super helpful in just trying to maintain proper low back pain position. All right, one last little nugget I'll give you for today is a back extension exercise to kind of help accentuate the back. And this should really make a big difference in pain in the leg and buttock. If you're doing it and it creates symptoms in the leg, then I would suggest that you consult with your physical therapist. So let's go ahead and stand on up. What you're going to do is you're going to get your feet about shoulder width apart. She's going to put her hands on her low back and then just going to arch over the back of her hands. So she's going to hold pressure on and then back off. Okay? Pressure on and back off. And let's do just 3 more, Carrie. And I usually suggest doing 5 to 10 reps and see how you feel. You might feel a little stiffness in the back, but you should definitely feel an improvement as far as the low back, glute area or down into your leg. So, okay, thank you, Carrie. I'll let you go ahead and sit. All right, so if you have any questions, you can get a hold of us. Our phone number is on this video. The lumbar roll you can find anywhere, Amazon, online, your favorite physical therapist. They'll sell them as well. It's a great way to just get your back in a little bit better position. All right, and become more aware of your posture. All day long, it's going to have an effect. It's cumulative. So even today, just start with a little bit. Start with something simple by just adjusting yourself in your chair. All right, have a good day.